Hello everyone, my name is Luis Flores and I am going to be talking about corticosteroids, acetaminophen, NSAIDs, and vaccines. Questions I'm going to be covering today is what are the differences between the corticosteroids and NSAIDs, and discussing the nursing considerations of NSAIDs. The next thing I'm going to discuss is the nursing consideration of glucocorticoids. Glucocorticoids, yes. And then another topic we're going to be talking about is the differences between acetaminophen and NSAIDs, and the nursing considerations of NSAIDs. And then we're going to talk about the common adverse effects of immunizations and the absolute contraindications that come with those. So with that being said, keep those questions in mind when we're going through these presentations. I'll bring them up again just to elaborate on those answers. Okay, so we're going to start off with corticosteroids. So what these medications do is they block the formation of prostaglandins in the body and leukotrienes, which means that it blocks the inflammation response and it blocks the immune response as well too. So with that being said, some of the adverse effects that comes from this is, you can see right here, is you're gonna see patients with mood swings, because corticosteroids are there to replace cortisol from adrenal insufficiency or anything of that sort. And you're gonna see slow wound healing, you're gonna see ulcers, and after long-term use you're gonna see osteoporosis and joint pain. Now with glucocorticoids, it's there to use the energy in the body faster. Now with that being said, it's going to increase glucose levels as well too. So some of the nursing considerations that you want to think about during this time is when the patient administers or takes it, as far as the glucocorticoids, is they should probably take them in the morning from 8 to 9, just because it's supposed to mimic of the normal effects of cortisol in the body. When it comes to that, you want to make sure you assess the patient's presence of ulcers, assess vitals, and keep in mind for hypertension and tachycardia when you assess vitals as well too. You want to advise the patient that she's at great risk of infection, so it'll probably be a good idea to avoid anybody that is sick. But those are just some of the nursing considerations that you should probably think about when it comes to corticosteroids. So yeah, hopefully those videos help you remember some of those things. And as far as corticosteroids, remember the good, the bad, and the ugly about them. So the good thing is that when it comes to these medications, any discomfort that the patient had prior to administration is going to be relieved, just because it gives the body time to heal. The bad thing about it is the side effects, as far as elevated glucose levels and osteoporosis for long-term use and stuff like that. But and then you want to think about the ugly. With corticosteroids, you want to think about Cushing syndrome. So the hump, the skinny arms and legs. So the good, the bad, and ugly of corticosteroids. But the good always outweighs the bad, right? So with that being said, we will discuss NSAIDs next. So NSAIDs are a little bit different than corticosteroids. The difference between these two is that NSAIDs also inhibits prostaglandin synthesis, but it also inhibits platelet formation as well too. So it inhibits platelets, so it thins the blood, so patients aren't able to coagulate normally. So with that being said, here's some of the adverse effects as far as the GI bleeding, the renal dysfunction, and some serious ones as well too, like the bone marrow suppression. So those are some things that are different than corticosteroids. This is more focused on the circulatory system and the kidneys. So some of the nursing considerations when it comes to taking corticosteroids is you need to assess the patient's GI function, assess the renal function by checking the BUN, the creatinine clearance, and the GFR for renal function. And you want to assess the inflammation, the pain, the fever, etc. for desired therapeutic effects, and assess vision in here for potential toxic effects. So the long-term use, so you want to think about, tinnitus with it's close to overdosing. And you want to teach the patient to avoid alcohol, and anybody who is pregnant 30 weeks or greater than that. And do not give these medications to patients after they had surgery. That's just going to increase bleeding. So those are just some of the nursing considerations that I just went through as far as like NSAIDs. Oh, and keep in mind that NSAIDs also block the COX-1 and COX-2 hormones in the body that control a variety of functions, but you can look that up. And here's some of the video examples that we've made for you to try to remember some of these effects. So I hope you enjoyed that video. So yeah. Hope you enjoyed that video. The next medication I wanted to talk about is acetaminophen. This is everybody's favorite over-the-counter drug. You could get this at any Walgreens, any CVS. Self-explanatory. So the mechanism of action between acetaminophen and NSAIDs is a little bit different. Acetaminophen acts on the thermoregulatory receptors in the hypothalamus. So it causes your body temperature to go down and causes vasodilation, which in turn makes you more comfortable than the state you already were. So with that being said, there's a little bit more different nursing considerations as compared to NSAIDs. So a lot of it was kidney function for NSAIDs. For acetaminophen, we want to focus on liver function. So when it comes to liver function, you want to monitor the lab values for the liver. You want to monitor also the patient's kidney labs as far as for it to be excreted from the body. And you want to educate the patient that the max dose of acetaminophen is 4 grams a day from all sources. So even if the patient is taking acetaminophen, you want to make sure that you list the other medications because there might be traces of acetaminophen in those medications as well too. So you also want to monitor for increased risk of bleeding and assess pain or fever for evaluation of therapeutic level. When it comes to this, there's a video that's going to explain what happens for patients, what the nursing considerations for patients who are alcohol dependent. We're going to actually lower those recommended grams a day for those type of patients to 2, and this video will explain why with the fish. Alright, good, okay. Last and not least, vaccines. So some of the adverse reactions when it comes to vaccines, we're going to talk about with this guy right here. So you can tell he's pretty happy he's got his vaccine, but he won't be when these side effects start to kick in. So anorexia, nausea, some of the things as far as the GI effects, malaise, fretfulness, drowsiness, irritability, and chills. Those are just some of the adverse reactions when it comes to some of these vaccines. With that being said, these are the absolute contraindications when it comes to prior to giving vaccine administration to your patients. So anybody that's immune compromised should not receive any vaccine, period. Anybody that's going through chemotherapy or radiation, absolutely not. Patients who have received immune globulin, blood or blood products within the last 3 months should not be getting those as well too. And you should not give any patient that's pregnant live vaccines because of the fetus that's in their body. So with that being said, I'm going to make some nursing considerations for you to remember. So take a chance to look at that towards the end of the video. As far as that goes, take some time to take your time to see the things that we went over, just as far as highlighting the important parts of this presentation. So with that being said, check out these slides for a little bit. Pause the video, take some notes on them. I'd just like to say thank you for your time. Thank you for checking out the video. Please give us a good rating. We really appreciate that. Shout out to my colleagues for for their hard work as far as putting the presentation. I worked on the video and the actors as well too. You guys will be getting your shout out as well too. So with that being said, good luck on your HACCIs. Study hard. Take advantage of the review sessions, and I will see you in class. Bye-bye.